What do atypical lymphocytes in lymphoma blood tests mean? When we talk about atypical lymphocytes in blood tests, we're referring to a type of white blood cell that looks different from normal lymphocytes. Lymphocytes are crucial for our immune system, helping to fight off infections. However, when they appear atypical, it can raise some important questions, especially in the context of lymphoma, particularly non-Hodgkin lymphoma. Atypical lymphocytes can indicate the presence of malignant lymphoid cells in the bloodstream. This might suggest that the lymphoma is in a leukemic phase, where cancerous lymphocytes circulate in the blood, resembling leukemia. This phase often indicates a more aggressive form of the disease and can be identified through blood tests that show these atypical cells. In lymphoma, atypical lymphocytes can vary depending on the specific type of lymphoma. For instance, in follicular lymphoma, you might see small cells with clefted nuclei. In diffuse large B-cell lymphoma, the atypical cells may appear larger and have vacuoles. Each type of lymphoma has its unique characteristics, making it essential for healthcare professionals to identify these features accurately. It's also important to differentiate between malignant atypical lymphocytes and reactive atypical lymphocytes. The latter can appear in response to infections, whether viral, bacterial, or parasitic. These reactive cells are part of a normal immune response and typically look different from malignant cells. When atypical lymphocytes are detected in blood tests, it usually leads to further investigations. Healthcare providers may conduct immunophenotyping to identify specific cell surface markers, molecular studies, or even a bone marrow biopsy to confirm the diagnosis and assess the extent of the disease. The presence of these atypical cells can provide valuable information about disease progression, prognosis, and treatment planning. In summary, atypical lymphocytes in lymphoma blood tests generally indicate abnormal lymphoid cells that may be malignant. Their identification is crucial for guiding diagnosis, staging, and management of non-Hodgkin lymphoma. However, distinguishing between malignant and reactive atypical lymphocytes is essential and requires thorough laboratory evaluation. If you have questions about blood tests or lymphoma, consulting a healthcare professional is always the best course of action.